So today we are going to discuss about ulcer clinical case discussion. So the case of ulcer usually comes as a short case in surgery postings, and so we will discuss how to take the history and how to do the examination of an ulcer case. So first I will show you different types of ulcer that you are going to see in your OPDs. Okay. So first is this is diabetic ulcer. It is because it is seen in diabetic patients, and it is because of increased glucose content in the tissues. Second is the Marjolin's ulcer. It is seen after burns, means when someone has burns, scar of burns, Marjolin's ulcer usually develops on those scars, burn scar only. Okay. Next is you have arterial ulcer and you have varicose ulcer. Okay, what will come under arterial ulcer? In arterial ulcer you can see this is because of arterial insufficiency, and the another is a varicose ulcer. This is a varicose ulcer. It is associated with varicose veins. It is more commonly seen on the medial side of the foot. Medial side means around medial malleolus, and less commonly it is seen on the lateral side, because on lateral side if it is there, it is associated with short saphenous vein, but most commonly it is associated with long saphenous vein, so seen on the medial side. You can see in the picture. Okay, so this is a varicose ulcer associated with varicose veins. Now next is this is trophic ulcer. It is also called as pressure ulcer, and it is seen in diabetics patient, and it is seen in leprosy patients. Okay, so these are all different kinds of ulcer that we have seen. Then next comes history. So how we are going to take the history? So first, let us suppose a 30-year-old man presented to OP with history of rapidly increasing lesion over right leg of 4 months duration. So a lesion was there on right leg and it was rapidly increasing in size. So initially that lesion was small, and in the course of 4 months that lesion started increasing in size. Okay, and lesion was initially painless. No pain was there with the lesion, but since last month, 1 month, patient is complaining of pain with that lesion. Okay, and then you have to ask the aggravating and relieving factors. So the pain is aggravated by movement of the limb. Whenever the patient moves the limbs, pain is increased, but it is relieved when you give rest to that limb. So this is how you are going to take the history. That means the time course of that lesion, what are the aggravating factors and what are the relieving factors. Then next comes the past history. So what will come under the past history? So in past history you will tell whether there is any history of weight loss, any swelling in inguinal region, in the abdominal region, or any history of burns, because if burns are there, then it suggests us that it might be a Marjolin's ulcer. So you have to take the history, complete history. Any history of burns to both the limbs, anything that you have to ask. So that this patient said that there is history of burns to both the limbs 12 years back, which was associated with scarring, and that ulcer is developing on that burn scar only. So it is giving us an idea. Means after history only we have got an idea that okay, this is Marjolin's ulcer. Why? Because it is developing on the burn scar. Then no history of surgical intervention in past and no addictions are there. Okay. Then next, summary on the basis of history. So a rapidly increasing lesion over right leg, okay, from last 4 months, yes, associated with pain and difficulty in walking, yes, and then history of burns 12 years back involving both limbs. So from the history only we are getting an idea. Impression after history is Marjolin ulcer. Now we will confirm it with examination. So first of all, always start with the normal side first. So in right and left, which is the normal side here? Left side, because in right side the patient is having that burn scar and that ulcer. So left limb appeared normal except for a 3 into 2 centimeter scar. That was burn scar on both the limbs. It was there, no? So that burn scar was there, no ulcer. On left limb it is completely normal, and that scar is above the medial malleolus, and you have to tell the dimension of that scar. Then a 7 into 7 centimeter ulcer is seen on the right leg involving anterior and medial aspect of the leg. I have told you that more commonly this ulcer is seen on the burn scar, means marginal ulcer is seen on burns scar only. So it is present there, and this ulcer is present in the region of burn scar measuring 10 into 8 centimeter. This is the dimension of that scar of that ulcer. Okay. This ulcer dimension is 7 into 7 and burn scar dimension is 10 into 8. Means we have to tell both the dimensions of the ulcer as well as of the scar, and it is present on the right limb. Okay. Next comes, now you have to describe the ulcer, that is the margin. Okay, it is having irregular margin, raised everted edges. Inverted means inside, everted means moving outside. So it has everted edges, and you are seeing slow on the floor, oozing of blood is there. Base is formed by underlying bone. Okay, because of that ulcer there is necrosis of the tissues, and you can easily see underlying exposed bone. So bone is there which is exposed, no palpable inguinal lymph node, and you cannot see any inguinal lymph node, no neurological deficit in the limb, means means that is no neurological deficit means the tone and movement and power of that limb is completely normal. There is no neurological deficit of that limb. Only you are seeing ulcer with irregular margin, raised everted edges, slow on the floor, oozing of blood and exposed bone. We can see that. Okay. So next comes the provisional diagnosis. So what is the provisional diagnosis? A 32-year-old male with ulcer in the right lower limb in the region of previous burn scar. It is suggestive of Marjolin's ulcer. So in this way, you can take history of any ulcer. Okay, means you should know the features of ulcer associated with that. Means you should know, okay, this is, okay, arterial ulcer, okay, these are the features of diabetic ulcer, means that will give you an idea. Okay, and you should know the features of mucous ulcer, trophic ulcer. So different kinds of ulcer you are going to see in the OPDs. So you have to take history in this way only. First of all, ask the patient in which limb and from how long, whether it is associated with pain, what is the dimension. Ask about any swelling in any inguinal region, in abdomen region. You have to ask that, and then you have to give a summary, and then you have to give provisional diagnosis. So this is all about clinical case discussion of ulcer. Thank you.